Thank you very much. I'm going to talk to you today about cell phones and health and what the latest science has to show. Let me set the context for the morning and afternoon. I want to tell you it's a great honor for me to be here today, and really a thrill, because there are people in this room right now whom we all need to thank. And I want to say, Senator Mark Leno, I will ask you to stand, please, because you have been so instrumental in working on this issue. And had the foresight to recognize that when it comes to public policy, it's better to err on the side of preventing harm rather than proving danger. And we will have a further discussion about how the debate has often been framed as to, do we have the body count yet? And how the debate has been about brain cancer. Do we have enough proof of brain cancer? That's the wrong question. We are conducting an experiment right now on all of ourselves and our children and my grandchildren. We're conducting an experiment precisely because we do not have data on safety. It never was obtained. And rather than debating whether we have definitive proof of harm, we should be asking, is there sufficient evidence to consider that prudent precautionary policies are appropriate? And I think after you hear our presentation today, you will say yes. I'm going to briefly talk to you about some of the experiments that have been done with human sperm. Sperm have the virtue of being readily available, and it takes about 500 million to make a healthy child. That's because you want the healthiest sperm to succeed in fertilizing the egg. These studies I'm going to show you took sperm from healthy men. One test tube did not get exposed to cell phone radiation, and the other did. And what the results were quite stunning. Sperm exposed to cell phone radiation died 3 times faster. 3 times faster. And in terms of a measure of damage on their mitochondria, had 3 times more damage to the mitochondrial DNA, just from cell phone exposure. An observational study conducted by the Cleveland Clinic by Ashok Agarwal, a very distinguished expert in male health, has shown that men who keep cell phones in their pocket at that time for 4 hours a day have sperm count about half those who reported little use of cell phones. Now, I want to show you what's been diagnosed in Korea recently. Digital dementia has been diagnosed in children. It involves memory problems, difficulty handwriting, difficulty looking you in the eye, difficulty developing empathy, and it's a diagnosed brain condition confirmed by MRI scans of these children. This is not some Saturday Night Live joke. This is the future of the brains of the world's children. The hemisphere of the brain, the right hemisphere, which is what allows us to be empathic and to understand things, is underdeveloped. And it's such a concern that the Korean government has issued warnings. This is what Turkey has done, and we'll hear more about that shortly. Governor Aksoy Hussein of Samsun is launching a cell phone campaign, thanks to Professor Suleiman Kaplan, to give information to people about how to use phones safely. Belgium, the public health minister, has banned the sale of phones to children under the age of 7. And Australia has recently issued more advice as well.
Theodora Scrotto, I'm Executive Director with Environmental Health Trust, and we're working on this issue nationally and internationally. I think, speaking of millennials that were discussed, millennials are entirely unaware that the technology they love could harm their future ability to have children, could damage their memory, and could cause brain cancer. Contrary to assumptions that the radiation is low, be aware that industry has stated publicly in presentations that the radiation increases into communities from a fully deployed 5G network would exceed several countries' current radiation limits. The U.S. has among the highest allowable radiation limits, in the world. Why? Because, as was stated 22 years ago, the EPA was actually defunded from researching and setting proper safety standards that protect us from biological effects, and instead adopted radiation limits by industry-filled groups. based on outdated science. And as a recent Harvard investigation documents, our agencies are captured at the highest levels, with a revolving door between FCC leadership and wireless executives. Our regulatory system is broken, and that is why governments need to act at every level of government, not just with addressing the FCC. Cellular radiation is a new, rapidly increasing form of environmental pollution, and numerous peer-reviewed studies have shown effects from low levels, quote unquote, of this radiation, which are below FCC limits. The CDC just released findings of increased rates of brain, liver, and thyroid cancer among those under 20 in the United States. And replicated research has shown that this radiation can promote cancer growth when in combination with other toxic exposures. Hundreds of scientists have issued an appeal for urgent action to halt 5G because of this science showing effects below government limits. I just want to point out, as was stated earlier about the firefighters, there was neurological damage shown.
International Association of Firefighters disagrees. They began opposing cell towers on fire stations after firefighters complained of health problems.
These firefighters developed symptoms.
Dr. Gunnar Heuser conducted a pilot study on firefighters at a station with cell towers.
And the symptoms included problem with memory, problem with intermittent confusion, problem with weakness.
Heuser says their brain scans suggest even low-level RF can cause cell damage, and he worries about more vulnerable groups like kids.
So we found abnormal brain function in all of the firefighters we examined.
So, following lobbying by firefighters, Cork and his co-author exempted fire stations from their bill, making them one place cell companies couldn't put a tower.
This is the first piece of legislation that I think anyone's aware of where somebody got an exemption because they were concerned about health. Did they tell you at all about the study?
All I know is that when the firefighters ask, I do what they ask me to do.
Because they're strong lobbyists.
Yes.
So if, say, school teachers and parents had a strong lobby and they asked you to pass something that would prevent these from going up in your schools, would you do that?
If I couldn't get the votes any other way.
Firefighter and cancer survivor Tony Stefani notes,
it's not only firefighters, it's the people that live in the general vicinity of these towers.
Current regulations don't take into account continuous low-level exposure from these small cells 24 hours a day.
More of these studies have to be done.
There are 230 scientists from 41 countries who have apparently reviewed more than 2,000 peer-reviewed studies, and they're calling on the World Health Organization to do more studies.
This issue cannot be put aside as go to the FCC. We need to take action now to protect communities. I also want to add that the public needs to be informed, because when they know, they will demand safe technology. And I would ask the council to develop new protective zoning and to a campaign to increase awareness among the public. You can do this. Thank you.
In December of 2009, I first met Donna. She was very healthy, vigorous, athletic, no predisposing factors for cancer. Family history was negative. From everything I could see, there was no obvious explanation for this young woman to have a breast cancer, particularly a multifocal breast cancer. And the only possible association I could identify was that she had a habit of always carrying her cell phone under her right brassiere strap. Breast cancers are characteristically diagnosed in women in their 50s and 60s. The Asian population have a lower incidence overall. Due to Donna's young age, lack of risk factors, multifocal disease, Asian history, normal medical history with no predisposing factors, I would say that she would be an unusual case.
I don't have any history of breast cancer in my family, and I also had the BRCA1 and BRCA2 genetic tests conducted on me, and it came up negative. So I don't have the genetic mutations for breast cancer. And with each following doctor appointment, it seemed like as if they kept finding another tumor and another tumor. We connected the dots of where the locations of the tumors were based off the biopsy. We made marks on me of where the location of the tumors were, and realized that it formed the shape of the cell phone underneath the footprint of the phone where I used to keep it.
When they did the imaging, the MRI and the mammogram, the ultrasound, we saw this unusual distribution of these little bitty tumors that were pretty much in the same general distribution of the rectangular cell phone. And when we finally did do our mastectomy, we saw this very unusual pattern where these multiple small cancers were confined to the upper inner aspect of the breast. And so I've never seen anything quite like this. And of course, there's no proof that it causes cancer, but again, the manufacturer said, don't keep it in contact with your skin. And we have this anecdotal information that makes me very nervous. And if I had a daughter, believe me, I would counsel her against doing this. And we've really promoted the concept.
If there is even a small possibility that the thermal or piezoelectric effect or other pulse electromagnetic field influences could even remotely influence the behavior, biology, and possible carcinogenicity in this setting, I would urge people to avoid exposure